Dr. Lisa Cassileth is a Beverly Hills plastic and reconstructive surgeon who has also appeared on numerous shows. You've probably seen her from
Nightline, The Doctor.
all sorts of shows.
Yes.
So she joins us right now. Dr. Lisa, welcome to TMZ Live.
Hi, thanks.
So what about the decision, essentially? I mean, in a sense, it's kind of like playing the odds in Vegas, that she had an extremely high percentage rate of getting breast cancer, and she decided to cut it off at the pass.
Right. I mean, a lot of these women now are finding out, let's say, if their mom had breast cancer at an early age, first they have to figure out, do I even get tested? Because now it's pretty obvious if you test positive, especially look at her, over 80% odds. Overall, it's over 60% chance if you carry the gene, you will get breast cancer. So to have to go through chemotherapy or radiation or the other things associated with actually getting cancer, it's such a big deal and so potentially negative. My God, you can die from breast cancer as well. That to go ahead and do a prophylactic mastectomy makes a lot more sense.
So this, I understand, is something where they don't necessarily do the surgery. If somebody were to find this out in their 20s, they wouldn't necessarily do it when they're in their 20s. They would wait, and I had read this today, that they would wait possibly until the person was around 40 years old. Is that correct?
Well, actually, we're usually doing it in the 30s, and some people, depending on the gene mutation, because not all gene mutations are the same. Some women with BRCA positive actually get it in their 20s, so it's not, just one vanilla style. Often people are even having the mastectomies very young if they're in the higher risk form of the mutation.
So if somebody had Angelina's mutation, the same form of mutation, and they tested in their 20s, would a doctor recommend for them to wait until they got into their 30s, or would they do the procedure then?
I don't know what her exact mutation was, but of course she waited till she was a little older, and it worked out fine. With her mother also had, a fairly aggressive form of breast cancer. So, there's no doubt she was at higher risk and that it was a good idea, for her preservation of her life, her breast, her well-being, to be able to do it prophylactically. Then you can, do other things that are cosmetically better too. Nipple-sparing procedures. So these women basically have normal-looking breasts when they're done with their reconstruction.
Actually, Lisa, if you could tell us about that, because we were just talking about the fact that Angelina went through this over several months and was still out in public, and nobody was any wiser that this was going on. Is that a testament to what the reconstruction?
Well, it's really been a shift in the way breast reconstruction is done. The old school was that everyone got a big cut all the way across their chest. You didn't have any kind of normal, the nipple, the areola completely gone. And then down the road, they'd have a breast reconstruction. Well, now generally what everyone is doing is first putting in a tissue expander, which is this kind of space-saving device that allows you to spare all of the skin of the breast, and then later swapping it out for the final implant.
I would think there'd be a seismic change in terms of, A, the number of women who are being tested, and B, the number of women who are following her course of treatment.
Well, exactly. I mean, think of the attention this is going to pay for women that potentially have this gene, that are walking around like time bombs, when they could have a work done, have a fantastic outcome. Maybe they're not going to be on the red carpet, but hey, they can function in their normal life day to day, take care of their kids, still be successful, and meanwhile have a great outcome, just like she has.
Okay, well, listen, thank you so much for joining us. Really appreciate it. This is interesting. Really appreciate your time.
Okay, my pleasure.
Thank you again.